You wake up with that weird feeling in your chest, a tiredness that just won't quit, a shortness of breath that hits when you climb the stairs, when you carry the grocery bags, and you think, must be stress, must be my age, must be the heat. You drink some water, lie down for a bit, and wait for it to pass. And sometimes it does. The problem is, in a lot of cases, what passed wasn't the problem. What passed was the signal, and the body is going to send that signal again, and again, and again, until one day it stops sending signals altogether. I'm a doctor with almost 20 years of clinical experience, and one of the situations that haunts me most across this whole career is patients who show up at the hospital after a heart attack and tell me, almost embarrassed, "Doc, I felt something was off for days. I just figured it was nothing." That happens far more often than any statistic can capture, because the numbers show who made it to the hospital. They don't show who stayed home waiting for it to pass. What I'm going to show you today is this. Your heart doesn't just have a heart attack out of nowhere. It warns you, sometimes 7 days before, sometimes 2 weeks, sometimes a month. And those warnings follow a logic you can learn to recognize. I'm going to walk you through the signs from the most obvious to the most silent, from what everyone's heard of to what almost nobody connects to the heart. And stay with me until the end, because the last sign on this list is exactly the most deceptive one, the one most people ignore because they think it's coming from a different organ entirely. Before we go any further, I need to be straight with you. Nothing I'm about to tell you replaces a visit to your doctor. If you're experiencing any of these signs intensely, persistently, or in combination, go to the emergency room right now. This video exists to help you recognize what your body is already trying to tell you, not to give you a false sense of security that you can diagnose yourself. The best thing this content can do is push you into your doctor's chair before you need a hospital gurney. Let's start with the sign you already know. The most obvious sign is chest pain. Everybody knows that. But what most people don't know is how that pain actually works in the days before a heart attack. Because it's not the pain of the heart attack itself. It's a different kind of pain, smaller, intermittent, a pressure that shows up when you exert yourself and disappears when you stop. You walk up the parking ramp and feel a heaviness in the center of your chest. You stop walking. The heaviness goes away. You think, must have been a coincidence. 2 days later, it happens again. That has a name in medicine. It's called unstable angina. It's the coronary artery saying that the space for blood to pass through is getting too narrow. The fatty plaque has been building up, and now during moments of physical effort, when the heart needs more blood, what arrives isn't enough. The heart muscle complains, and that complaint reaches you as a feeling of pressure. The problem is that when that pressure is small, it feels like nothing, just a passing thing. Think of it this way. It's like trying to drive a wide truck through a tunnel that's been getting narrower for years. Most of the time, the truck gets through, but with effort, with difficulty. And at some point, a truck is going to come along that simply doesn't fit. When unstable angina shows up, it's already an emergency signal. Not a, let me schedule an appointment for next week situation. A go to the ER today situation. The second sign is shortness of breath with no explanation. There's a very common confusion here. People associate breathlessness with lung problems, asthma, bronchitis, some infection that's going around. But the heart and the lungs are very close neighbors, and when one isn't working right, the other suffers too. When the heart starts struggling to pump blood efficiently, fluid begins to accumulate in the lungs, and that buildup creates the feeling that air just can't get in right. You don't have pneumonia, you don't have asthma, your heart is asking for help, and the warning arrived through the lungs. The sign I look for in my practice is shortness of breath that's out of proportion to the effort. You take a walk you've always done without any trouble, and today you're winded. You go up a flight of stairs that never tired you out, and now you have to stop halfway to catch your breath. Or, what I find even more alarming, you wake up in the middle of the night gasping for air without having done anything at all. That last one, waking up breathless in the middle of the night, I treat as a cardiac emergency until proven otherwise. Let me tell you about Claudio. 63 years old, retired truck driver, born in a small town in the Texas-Mexico border region. Man of very few words. The type who considers going to the doctor a sign of weakness. He came to my office on a Wednesday afternoon, brought in by his oldest daughter. He didn't want to come. She was firm. When I sat down across from him and asked what he was feeling, he shrugged. A little shortness of breath sometimes. Nothing major. I asked him to walk me through it with more detail. In the previous month, he'd already woken up 3 times in the middle of the night, unable to breathe right. He felt like he needed to sit up at the edge of the bed just to get air in. After a few minutes, it would pass. Then he'd lie back down and sleep. He hadn't told his daughter. Didn't want to worry her. We ran the tests that same day. The EKG showed abnormalities. The echocardiogram confirmed his heart's pumping function was compromised. He was in mild heart failure, with coronary arteries in critical condition. If he had waited a few more weeks to come in, the story might have ended very differently. "Doc, I thought I was just getting old," he told me, eyes wet. "I didn't know that was my heart." The third sign is the fatigue that doesn't go away. And here I need to be precise, because tiredness is something everyone feels. The kind of fatigue I'm concerned about is not the fatigue of someone who worked too hard, slept too little, is going through a tough stretch. What concerns me is fatigue that has no explanation for its intensity. You sleep your hours, you didn't do anything different, and you wake up exhausted. A heaviness in the arms, a heaviness in the legs, that makes simple tasks feel like enormous effort. Taking a shower, making the bed, cooking lunch. A systematic review published in the Journal of the American Heart Association analyzed data from more than 5,000 women with a confirmed diagnosis of acute coronary syndrome and found that fatigue was the most commonly reported symptom in the days and weeks before the event, present in more than 80% of those interviewed. 80%. And still, almost nobody connects fatigue to the heart. What's happening inside? The heart, when it starts struggling to pump blood efficiently, activates a compensation mechanism. It beats faster to try to deliver the same volume of blood. That extra effort burns energy, and when the heart is burning more energy than it should just to keep the basics going, the rest of the body receives less. The muscles get less oxygen, the brain gets less glucose, and you're left with a feeling of exhaustion that no amount of coffee fixes. That's where the danger is. You drink more coffee, you grab an energy drink, you rest for a day, and because the symptom eases up a little, you think it passed. It didn't pass. If that's your kind of fatigue, I'm asking you for one thing. Don't tough it out. See your doctor. Before we get to the fourth sign, I need to ask you something. If this content is reaching you at a moment when you really needed to hear it, hit the like button right now. That simple gesture helps this video reach more people who might be feeling these signs today and have no idea what they mean. And if you haven't subscribed yet, do that now and turn on notifications. Tell me in the comments what state you're watching from. I genuinely love knowing where this community is growing. The fourth sign, and here we start getting into territory that surprises a lot of people, is pain that shows up in places that seem to have nothing to do with the heart. Jaw, neck, left shoulder, back, left arm, but sometimes the right arm too, sometimes the stomach. The heart doesn't have a monopoly on the pain it causes. The vagus nerve, which connects the heart to various regions of the body, can transmit the signal of cardiac distress to points very far from the chest. That phenomenon has a technical name, referred pain, and it's responsible for countless misdiagnoses because the patient shows up to the doctor with jaw pain, goes to the dentist, nothing is found, goes home relieved. The problem is the dentist didn't run an EKG. Women are especially vulnerable to this atypical pattern. Clinical studies show that women who suffered a heart attack report back pain, nausea, dizziness, and fatigue as their primary symptoms far more often than men, without chest pain. This makes diagnosis slower, treatment more delayed, and outcomes worse. You feel me? Have you been having a pain in your left shoulder that comes and goes for no clear reason? A pressure in your jaw you figured was a dental thing? Discomfort in your back you wrote off as bad posture? Those signs deserve attention. The fifth sign is what I call diffuse unease, and it's hard to describe because it's hard to feel with precision. It's a sense that something isn't right, without being able to put your finger on exactly where. A mild nausea that comes and goes. A subtle dizziness that kicks in when you stand up too fast. Sweating that happens without heat, without effort. Just there, out of nowhere. Cold. Cold sweat for no apparent reason is one of the signs I consider most urgent. The autonomic nervous system, when it senses the heart is in distress, signals the adrenal gland to release adrenaline in quantity. That adrenaline causes sweating, pallor, and that feeling that the floor just dropped out from under you. The body is in silent emergency mode. Now we get to the point I consider the most important in this whole conversation. The sign most people ignore. The sign that in my almost 20 years of practice, I've seen confused for something else more times than I can count. It's palpitations. Not anxiety palpitations, the kind you feel when you're nervous that go away when you calm down. I'm talking about palpitations that show up at rest, without any emotional trigger. The heart that suddenly races, that beats irregular, that makes you put your hand on your chest instinctively, like you want to hold it steady. In the days before a heart attack, especially when there's significant coronary disease, arrhythmias are common. The heart muscle, poorly irrigated, begins to fire electrical signals in a disorganized way. Sometimes that firing goes away in seconds. Sometimes it lasts a few minutes. And the person figures it was an anxiety attack, makes some tea, takes a deep breath, feels better. But that arrhythmia was the heart muscles screaming that blood flow is insufficient. It was the electrical equivalent of a light bulb flickering when the power grid is overloaded. Let me tell you about Sandra, 58 years old, public school teacher, born in Atlanta, Georgia, a woman who worked with an energy and joy that put 30-year-olds to shame. She came to my office on a Monday morning with a story that's stayed with me ever since. Doc, for about 10 days my heart has been speeding up sometimes, even when I'm just sitting there grading papers. It passes quickly, so I didn't think much of it. But yesterday it lasted longer, and it scared me. No chest pain, no severe shortness of breath, just those palpitations at rest, and a fatigue she was chalking up to end of the school quarter. The EKG I ran that same day showed a pattern that made me refer her immediately to the interventional cardiologist. The catheterization revealed 2 coronary arteries with significant blockage. She had an angioplasty the following week. When she came back to tell me how the procedure went, she said, "Doc, the doctor at the hospital said if I had waited another month I might not have walked out of there." That's what hits me hardest as a physician. Not the severity of the case. It's the detail that Sandra did everything right. She noticed something felt different. She came in. And even so, by a very thin margin, she nearly went from a warning to a catastrophe. Imagine all the people who don't come in. And that's the point I need you to carry out of this video. According to the American Heart Association, cardiovascular disease is the leading cause of death in the United States, responsible for 1 death every 33 seconds. In Brazil, where I practice, the Sociedade Brasileira de Cardiologia reports approximately 400,000 cardiovascular deaths per year. These are not rare events. They are the most common way human beings die. And the most alarming part, studies show that fewer than 5% of the population can recognize the early warning signs of a heart attack. Fewer than 5%. Classic clinical studies that interviewed patients shortly after a heart attack show that half of them were already feeling something different in the 4 weeks before the event. Half. And they ignored it, or waited, or attributed it to something else. The heart works like the central pump of a power plant. It's what keeps the flow going. When that pump starts having trouble, the whole plant feels the consequences. Power reaches the extremities with less force. The peripheral systems start to fail. And the first warning doesn't arrive like an emergency siren. It arrives like an alert light blinking on the dashboard. Subtle, persistent, ignored. Your job is to learn to read that dashboard. But before we talk about what to do, I need to tell you about the sign that closes this investigation. The number 1 sign, the most ignored, the most deceptive of all, is swelling in the ankles and legs. That's right. You go to the doctor with swollen legs, and the first thing they rarely think about is the heart. They think venous problem. They think fluid retention from the heat. They think some medication might be causing it. They think kidney issue. And all of those possibilities are valid and need to be investigated. But the heart is on that list. When the heart starts failing in its role as the central pump, blood doesn't return from the extremities efficiently. It starts to pool in the legs, the ankles, the feet. Gravity pulls that fluid that couldn't make it back up, and it settles there, in the lowest points of the body. Pay attention to this detail. The sign isn't in the chest. It's in the ankle. You put your shoes on in the morning and they fit fine. By the end of the day, they're tight. Your socks leave deep marks in the skin. Your feet seem to have grown. That is fluid that couldn't circulate. Let me tell you about Raymond. 71 years old, retired farmer, born in rural Mississippi. A man who spent his whole life outdoors, who never got sick, who thought going to the doctor was for people who couldn't handle things. He came to my office brought by his oldest son with one complaint. His boots didn't fit anymore. "Did you gain weight in your feet?" I asked. He laughed out loud. "All I know is they don't fit, but I'm eating the same as always." He wasn't gaining weight in his feet. He was in heart failure. His heart was pumping at roughly half the capacity it should have been. The swelling in his legs was fluid that the heart could no longer pull back up. When I explained the diagnosis, he went quiet for a good stretch. Then he said, "Doc, I thought it was just old man's rheumatism." It wasn't. In his case, early treatment allowed the heart to recover partially, with medication and lifestyle changes. 6 months later, Raymond came back to the office with his wife and told me, with that wide grin of a man who fit back into his own boots, "Doc, I'm working in the garden again. Not much, but I'm back out there." That moment of relief, of watching someone reclaim their own life, is what keeps me going. What do you do with all of this? First, pay attention to the combination. Any one of these signs on its own may have another explanation, but 2 or more signs showing up together in the same period especially if you have risk factors like high blood pressure, diabetes, high cholesterol, smoking, or a family history of heart attack, needs to be investigated urgently. Second, stop normalizing what isn't normal. Disproportionate fatigue is not just age. Breathlessness climbing stairs is not just being out of shape. Palpitations at rest are not just anxiety, until a doctor rules out the heart. Third, get your preventive tests done. An EKG, an echocardiogram, a stress test, and a full lipid panel can show you what is happening with your heart before your heart needs to shout to be heard. Those tests save lives. Fourth, know your blood pressure number by heart, the same way you know your phone number. Uncontrolled high blood pressure is the fastest highway to a heart attack. And high blood pressure is silent. It doesn't hurt. It doesn't warn. It just destroys. Quietly. Every single day. Until the day it decides to stop being quiet. Let's recap what we covered today in this investigation. The first sign, the most obvious, is chest pain that shows up with exertion and disappears at rest. Angina. It's not the heart attack itself, but it is the waiting room for one. The second is disproportionate shortness of breath, which can wake you up in the middle of the night, which shows up in activities that used to be effortless. The third is fatigue that won't go away, that has no explanation for its intensity, that doesn't respond to rest. The fourth is pain outside the chest, in the jaw, the left shoulder, the back, the arm, that the heart projects to distant points through the vagus nerve. The fifth is diffuse unease, cold sweats without effort, dizziness, subtle nausea that comes and goes. And the most ignored of all, number 6, is swelling in the ankles and legs that appears by the end of the day, and that so many people confuse with poor circulation, heat, or simply getting older. Your heart doesn't just have a heart attack out of nowhere. It warns you. And now you know how to listen. What weighs on me most as a doctor is not treating someone who didn't know. It's treating someone who knew, who felt it, who noticed something was different, and who waited. Out of fear, out of embarrassment, out of not wanting to worry the family. Those are the cases I carry with me. You don't have to be one of those cases. Share this video with that family member who you know never goes to the doctor. With that friend who's always saying she's exhausted, but thinks it's just the pace of life. With that buddy who you know is ignoring something his body is sending him. This video might be exactly the push they needed. In the next video, I'm going to show you what happens inside the coronary arteries in the weeks before a heart attack. How the fatty plaque ruptures, how the clot forms, and what you can do today to slow that process down. These are details most people have never heard from their own doctor. You're not going to want to miss it. Take care of your heart. It's the pump that keeps everything running. And unlike machines, it doesn't have a perfect replacement part. Treat it like it's the only one you'll ever have, because it is.